Dr. Maurit Beeri, the Director General at the Al-Ain Hospital in Jerusalem. Thanks for your time here. We've discussed some of the implications around children in other shows of ours here, but on the plans to now reopen the schools and focus today by the government, talking about limited classroom capsules, only in low outbreak cities allowing schools to reopen. But given the high infection rate still among children, should we be reopening schools right now?
Well, the question of opening schools is basically a political one. It is absolutely clear that the health implications of the children staying at home for such a long period are massive. And we're going to look towards years and years of damage control following this period. So there's a balance between the infection rate and the actual need to open the schools, which isn't directly related to the disease itself. What we've seen that though there is a massive increase in the numbers of children who test positive, we do not see a parallel increase in the number of sick children. Not every person who is positive carrying the virus actually shows symptoms of the diseases. With children, it's still minimum. Even though we have a lot of children testing positive, we do not have the hospitals inundated with children. The massive problem is still the adults. So there's a balance here. And if we had been keeping the quarantine and the control measures well, I would have expected the situation to have improved by now. The situation is that we're more worried about the children transmitting the infection to adults in their recent and close environment, than of them being actually sick. So the solution, as far as I'm concerned, is get vaccinated. If we vaccinate the adult population massively, then the children will not pose a risk, and then we can reopen the schools and feel that we're in a safe place.
Now, on the topic of the vaccines here, Israel has obviously been a world leader, not just in the pace of the vaccinations, but also progressive in some arenas too, approving it for pregnant women ahead of the World Health Organization, for example. Are we likely to see the vaccine opened up for children under the age of 16 in the near future as well?
So the Ministry of Health has sent out messages saying that they are for giving the vaccines to children who are at high risk, even if they're under 16 years of age. And at Al-Ain Hospital, where we treat the most complicated and complex children, though we don't see that these children are indeed at an increased risk of severe disease, we do know that these are very fragile children. And any disease, whatever it is, any virus passing by might be the one that will topple them over. So we are considering giving the vaccine to children under 16 years of age. And indeed, it is it's playing in an unknown field. We don't know the implications of this vaccine on these children. We have no data to this point to indicate that this is dangerous in any term for these children. So it's a risk assessment that would have to be taken with the physicians of a particular child together with the family and consider the implications. The world is going to get a lot of information from what we're doing here in Israel, and everybody's going to be better off with that knowledge. But come back to me in a few months and I'll be a smarter person and tell you what actually happens.
And Dr. Maurit Beeri, same for all of us here. We appreciate your input here, definitely on this important topic of the children right now as we stand on the cusp of major decisions here. Appreciate your time.
You're welcome. Have a good day.